Good afternoon, everyone, and welcome to session 2 of day 2 of the Case for Quality Collaborative Community Forum. I am very excited to be joined by our esteemed panel. This session will discuss the Leadership Engagement Playbook and Culture of Quality. Remember, we will be hosting a live Q&A at the end of this pre-recorded session. I am pleased to introduce Pat Schaefer. Pat joins us today from Connecticut. He is the Program Manager for the Leadership Engagement Working Group. I will turn it over to Pat, and he will introduce us to today's panel of experts. With that, hi, Pat, and welcome.
Well, thank you, Joe. So what we're going to be talking about today is leadership engagement. It's a work stream that basically we worked on over almost the course of 2 years. And I'll go into greater detail in a moment, but first I want to introduce our panel, who are all active participants in developing our work product, which was a leadership engagement playbook. Joe Sapiente, who is currently Associate Vice President at MDIC. Actually, I'm going to be speaking with him in his role as Vice President and Head of Regulatory and Quality at Hologic and also in his previous positions. Francisco Vicente is the Program Director for CDRH's Case for Quality, and he'll be giving us CDRH's view on these topics. Sarah Sulfridge is Head of Quality, the Head of Quality Strategy Office at Baxter Healthcare, and Meta Trivedi is Senior Director of Global Quality and Operations at Stryker. So why don't we jump right in? And next slide, please. So our mission, basically, we understood that leadership plays a significant role in driving quality and setting the tone for quality in the enterprise, in the company. And our sense was that if we can get leadership to move from a culture of compliance and really focusing on the regulations and focus more on a culture of quality and a culture of continuous improvement, that in fact the whole industry as a whole would rise. A rising tide floats all boats is the idea there. We had originally called this the CEO engagement work stream, but quickly realized that the team felt that leadership is much broader than just the CEO. The CEO certainly sets the tone at the enterprise level, but where we work day to day at manufacturing sites or in R&D or wherever we work, our local leadership also plays a huge role in setting that tone. So we moved from CEO engagement to leadership engagement. And our hypothesis is that if leadership promotes quality as a strategic priority, then basically there will be strong alignment, and ultimately everyone will own quality, and that the quality of the products and the outcomes for patients and providers will be better. So that's the theory. And we'll talk about how we prove that and how we implement that in this session. I did want to give a quick thank you to all of the team members who were very active in terms of providing it. Just a little bit on how we got to where we did is that we did a survey. I'm going to show the results of the survey in a moment. Then we collected best practices from over a dozen different companies, all of whom are leaders in the quality area, and then spent several months just aggregating all of the leading practices, or the best practices that we collected, and then distilled them down into the playbook that we'll be talking about. What we're going to do is we're going to pull and focus on 4 chapters within the playbook. There were a total of 10. Let's go to the next slide, please. So before we go into detail, what I wanted to do was talk a little bit about the survey that we did. Our first activity as part of developing the playbook was to capture a baseline. We created a survey. There were 88 responses, and we asked 10 questions. We started with 25, and felt that that would be way too onerous a survey. So we spent some time, probably about a month, consolidating the topics, combining them and rewording them and coming up with a vital few, 10 questions, which were submitted to leadership across the respondents. The questions were: does leadership promote quality? Does leadership prioritize quality over cost? Do leadership and employees understand quality and their role in quality? Is quality integrated into performance reviews? Are there objective quality performance measures? Do you engage your employees or staff to understand behaviors that drive quality? Is quality strategy effectively communicated? Are you focusing on prevention rather than reaction? Do you formally measure the cost of quality? And then do you benchmark and share best practices? So these are the results. And overall, leadership felt that pretty good. There were two clear areas where there was a lot of room for improvement, and both of those will be covered in our four focus discussions coming up. First is, do you focus on prevention over reaction? And 53% did not feel that way. And then finally, 61% do not formally measure cost of quality. So again, we'll be talking about both of those. One of the interesting things, this survey was submitted to leadership at the corporate level and at the site level. And this is their perspective. One of the observations that the team had was that perhaps the employees don't share the same view in terms of how well leadership promotes quality or on any of the topics. So that's an interesting thing that I think needs to be explored in further. Why don't we go to the next slide, please? So the first topic was that we want to do a deep dive in was around quality in my role. And I'm going to ask Joe about his experience with an initiative that he led in his previous roles called Quality Begins With Me. Joe, can you give us some background on this, please?
Yeah, sure, Pat. Thank you. So in my experience when I was with Covidian back in the early 2000s and head of quality and regulatory, we had, obviously, like many companies, a series of KPIs and key performance, expectations for overall performance. And one of the things that was really something that we did as a company during our period where we were doing a lot of acquisitions and integrations, we had very different quality systems that we were integrating and trying to integrate cultures from one company into another. And so we developed this program, which was a quality improvement program, or QIP program. And it was focused primarily on processes and procedures within the manufacturing and quality space. And that program we launched in 2006. And then around 2011, when we monitored and we kind of sort of gave ourselves a score or a grade based on our annual performance, we were not pleased with the overall performance for that year. There were some things that just didn't flat out meet our expectations. We had too many field actions. We felt that there were too many non-conformances internally, things that we could have prevented through proper execution and awareness. And so we developed the program called Quality Begins With Me, and that was really focused on connecting the frontline employees to the role that they play in quality. So at the very top level, we had endorsement from our CEO and the leadership team around developing or outlining and creating a strategy that focused primarily on culture and your role. So we really developed a program that focused on key behaviors. So what does it look like to be patient focused? And what programs did we develop that allowed or emphasized the role that we all play in the path, or the care path of a patient? We developed some I statements around, what does it look like to be patient focused? Like many companies, we engaged our patients and providers and healthcare professionals much more actively in programs so that we can create that connection. So frontline employees really made that connection to, hey, you know what? I touch the product, I touch the patient. So the patient focus, patient awareness was very important. The other areas we focused on was empowering the frontline employees. So what does it look like to be courageous? And if you see something on the line, on the production floor that doesn't look right, say something and be courageous to go to your manager, your production manager, and if it got to that point, to shut the line down. And these were all things that were embraced and reinforced by the leadership team. The message was very clear from the top down that the expectations that we had around empowering our employees to do the right thing, to see something, say something, to be patient focused, was coming from the top. It wasn't just something that we were talking about. The other piece areas that we focused on in behaviors was accountability, as well as Pat mentioned, on preventive. So what does it look like to be accountable? So you're accountable to yourselves, you're accountable to each other, and you're accountable to the patients that these products were being used in. So again, that goes back to that empowerment and being courageous. And then what does preventive look like? And that's something that many companies tend to focus primarily on being reactive. So how do you start promoting a preventive culture? And again, this program helped empower folks to stop something from being by being courageous, but then applying those lessons learned and continuously improving in areas that, well, do we have this risk elsewhere? And can we prevent an issue from occurring based on an experience that we had? So the program was built on those behaviors, and we also leveraged existing programs with regard to reinforcing and rewarding for those behaviors. So ongoing programs within the company for rewards and recognition. We then included rewarding and recognizing folks that were living up to the quality begins with me behaviors and demonstrating what those behaviors looked like. And so the way we measured ourselves was we developed an appraisal program very similar to the quality improvement program appraisal system that we had. We developed a appraisal program for measuring culture and how are we implementing culture change, and how are we rewarding ourselves, and how are we acknowledging that folks are making a difference.
Thank you, Joe. Sarah, at Baxter, do you have a program in place to basically model behaviors and drive quality across the workforce?
Absolutely. And funny enough, we modeled it after some of what Joe has been talking about. We happen to call our program iCare, but it is embedded throughout every single one of our facilities and in the corporate spaces as well. So it is absolutely changing the focus for our employees to keep their concentration on the patient and always make the right decision. And that's really what is stressed every single day throughout every single facility.
Maida, how about it, Stryker?
Yeah, very similar to best practices we heard from Joe and Sarah at Stryker. We've been on the quality first journey for a very long time now, and it's essentially around the tone from the top we hear from our CEO onwards and all our business leaders. Quality is first in everything we do, and customers and patients are at the heart of our decisions every day. So it flows through right to the assembly level and the manufacturing teams, that we talk about quality, whether it's in our daily meetings, whether wherever we start presentations, we talk about quality. Even in business reviews, we talk about quality first. So our program of quality first has really, really helped drive that culture of keeping quality at the heart of everything we do. And as Joe mentioned, I think patient stories are very powerful. We have a lot of patient stories that we display either at town halls or production floor meetings or even business reviews, whether it's AED patients or hip replacement patients or stroke patients. We actually bring them on. There are forums where we actually bring the surgeon and the patient on to talk about our products and talk about the improved lives from the patient themselves. So those are powerful emotions that get stirred in the manufacturer or the assembler or the R&D designer or the supplier quality person. When they look at all of this and see that what they do every day has an impact on a real person and they hear the stories, it's a powerful message to drive culture of quality further.
So we've just heard from 3 people who have basically led leading practice quality initiatives in their company. Cisco, I'd love to ask you, you have a broad view of the industry. Would you say that we've just heard examples that are typical of the industry, or where do you think the industry sits today in terms of the employees understanding the value and importance of quality?
So I think actually, and what you're hearing here is a set of organizations who've chosen and put that into practice. It's not it's not to say that it isn't a goal that companies have, right? But it does take a concerted effort. I think you heard it beforehand. It takes that commitment from leadership. It takes the willingness to kind of drive that integration and make that personal connection. I think as Minette had mentioned right here beforehand, and Joe had mentioned, it isn't collectively seen across all of the industry, right? It's one of the reasons why the work that was done here and highlighting some of that is really important. You see the difference it makes in the organizations when they start to make that transition and shift in that journey. We've got lots of examples where, it's one thing to have that quality vision up on the board. There's another thing that when you see that being brought to life, right? And you see that being brought down to that level of the staff, and you start to drive more integration on all the work that's being done, which is a lot of what we've been looking to do with all of this engagement in Case for Quality. And we've actually seen and had the opportunity to participate and engage with companies who have done this and seen the effect it has on site. So not necessarily common. That's one of the reasons why I think it's all being put together in this idea of a playbook. But I think instinctively most companies know it's the right thing to do and where they want to be. It's just the idea of how do you get there.
Great, thank you so much. Let's move on to our next topic, prioritizing quality. Sarah, in my experience, it's always been difficult to prioritize quality over cost. You have pressure from shareholders, pressure from line management to increase throughput, and quality sometimes is perceived as a roadblock or a barrier to speed. Can you give us, your perspective on prioritization?
Sure, absolutely. And what I want to do is put that perspective in context of a quality culture. Being at Baxter now almost 15 years, I've watched this culture ebb and flow. And most recently, say over the last 5 years, our quality culture has grown stronger and stronger and stronger. And I'm really excited to share some of our lessons learned. So when we think of prioritization, we typically think of, that the fact that activity 1 is more important than activity 2. And in this business, those thoughts often place compliance-based activities in competition with growth and innovation or even efficiency-based efforts. And then this is the point where many folks typically start to run into struggles. So my challenge for all of you and what we did is we started to think of quality outside of the rules and regulations, which resulted in our efforts now becoming complementary and not in competition with each other. We had to assume that patient safety is always at the forefront of our minds and that producing high quality products for our patients is the underlying driver of this industry. Then the challenge becomes, and it became, how can we make this happen when traditionally we think we must only satisfy compliance requirements? We need to drive a culture shift to create an environment where quality goes beyond compliance and even challenges the current compliance mindset. And it starts with all of us as leaders. So I'd like to give you a bit of context of what you see on the screen. So first, use the data. We need to bring to the forefront of our thinking and embed in our everyday decision-making the focus and value of scientific data. our experience told us that we need to adopt a science-first policy. Every decision must be scientifically justified, regardless of the regulation. And when the data directs you to the same solution that the regulations require, then great, awesome. And that means that we have consistency and sufficiency of our reasoning. Now, when the decisions dictated by the data conflict with the regulations, then we have to have a conversation. This can be a little scary, but it's this data-driven conversation that will force the evolution of our entire industry, where we no longer just state the regulation or the common practices that we're used to. And when we use this data, we're no longer limited to compliance-based solutions. And our industry then naturally arrives at the correct prioritization. Because after all, the things that drive good quality are the exact same things that drive good performance. So if we focus on rigor and data and having a state of control in our facilities, then the compliance will follow, but quality will lead. So number two, we want to create new experiences. We're all very familiar with our regulations, and some people really love these rules, and the rules are good and they're important and they're here to ensure the patient's safety. Where we had an opportunity to improve was where these rules would then translate into a check-the-box thinking, which then limited growth and accountability, and especially innovation. Now, I'm certainly not suggesting that we ignored the regulations, not at all. I am suggesting, though, that we put quality first, and this is where every leader is needed, was needed, and is still needed to create a new environment where employees gain new experiences from us, from leaders, and from each other. Now, I'll tell you, those might sound like very high-level, fluffy words, but we too often overlook or fall short of ensuring that we've set up our new environment for the long haul. We really need to be able to sustain this environment when new challenges come our way, which seems to be daily in the world that we live in. It is critical that we consciously communicate in a way that helps promote this new way of thinking. Too often, we communicate the how first, thinking that this will speed the adoption and make it easier for others to understand, when in fact, if we do not first communicate what, and then why, and then how, we've taken away the person's ability to think critically about the change, and we've not only prolonged the timeline for adoption, we've often just pushed them back into thinking in a rules-based way. And this becomes that check-the-box exercise, which doesn't allow for the space to be creative and innovative. This takes practice, and I can tell you it is worth it, because operating in this new culture of quality promotes aligned behaviors where everyone is striving toward aligned goals and priorities. My challenge to you is to really think, act, and speak in a way that embeds quality as a priority in all your activities, and not as a set of prioritization activities that are separate from the rest of your business. Encourage and grow the quality beyond compliance mindset, and challenge the regulations. Have the courage to speak directly with regulators and base this conversation on scientific data. I guess my parting words are that this isn't always going to be easy, and I want to encourage you to remain courageous and to persevere, because this is a quest, and we need to do what is right in providing the highest quality products for all the patients. So with that, I'll turn it back to you, Pat.
Well, just a quick question before I turn over to some of the other panelists. Have the results borne out the strategy that if you focus on quality, there will be fewer compliance issues and throughput is not going to suffer? Have you measured that?
Absolutely. We measure our compliance goals. We also have our performance goals. And what we have found is our quality indicators are all becoming more and more positive. Our recalls are going down. Our complaints are going down. The first pass yield is going up. Our batch releases are going up on time with better quality. And then you move over to the business side. We're able to get products on market faster, and we're able to service our patients better. So we measure quality, not just with simple quality indicators, but we look holistically, like Cisco was saying earlier. It's an entire ecosystem, and we look across the board.
That's great. Thank you. Joe, tell us your experience in terms of focusing on quality rather than compliance.
Like, I think Sarah covered it really, really well. And again, she's sort of taken what was developed and turned it into the 21st century version. But I think when we started the Quality Begins With Me program, it was really about behaviors and execution. It wasn't that we were out of compliance. It was that, you know, the performance wasn't up to where our expectations were. And you know, we started within the manufacturing space and the quality space, expanded it to core products and development and commercialization. So to Sarah's point, you know, she's talking about an enterprise-wide adoption of a culture of quality. And that's the goal, right? You want to be able to get folks that are closest to the product to drive those behaviors and show a correlation, right? Show a cause and effect, because then the rest of the organization that may not be as close to the core team or the commercialization of product start to deliver on their role and how they impact quality. Not just product quality, but interaction with customers. And what's the experience like to work with a company that is focused on a culture of quality beyond the products? And so, you know, the correlations that we saw in the early development of the Quality Begins With Me program, really, I think Sarah complimented those by saying, you know, we saw fewer issues on the floor. We saw fewer issues in terms of challenges and poor execution, right? And it didn't require a rewrite of your procedures to bring you into compliance. It required an awareness of what you do and the impact you have on the overall product quality. Because again, having a compliant procedure isn't guarantee of quality, and vice versa, right? So, but if you've got good procedures and you're executing those procedures, your product quality will follow. But then I think what Sarah's touched on and really is, how do you bring that into your design process early and get folks that are beyond that check the box? Well, we delivered that standard. We meet that standard. Well, it's much more than meeting or delivering on a standard requirement. It's what's the expectation and what's the experience the customer is going to have with that product or the patient's going to have in terms of outcome.
I mean, at Stryker, what's your experience in terms of the balance of compliance versus quality, or is that even an issue?
No, very similar to what Joe and Sarah mentioned already. I think it is at Stryker, we focus a lot on the quality first mentality. And, you know, in terms of the prioritization, quality is always first. Quality and safety is first, and then everything else follows. Now, I would say that cost is a conversation that happens all the time. You know, the pressures coming from the industry and the business, and our healthcare teams want better cost. So the dialogue on cost is very much present. We have those conversations every day. We want to reduce cost, but I think there is a deep understanding, and we need to explain this to all our teams all the time, that it is not cost at the expense of quality, but it is better cost because of better quality. So if we think about trying to improve our processes, make them more efficient, make it better design, go with a better supplier, those all add up to lower cost eventually downstream, because we're not looking at processing, you know, X number of NCs, or we don't have CAPAs because we're already at a great quality level. So I think that distinguishing why and that prioritization nuance of cost and quality is important to differentiate. The other focus at Stryker has been and has always been on talent. You know, the compliance versus quality, you know, the procedure could be beautifully written, 400 pages, but if the engineer is not, you know, really looking at it for what it's intended and is just doing a check in the box, the design of the product is going to be, you know, not up to stuff. So I think focusing on competency improvement, focusing on talent development for our key members with that constant reminder of we are designing this product that is either going to go into somebody's body or it's going to make an impact to their lives is important, right from design to manufacture, all the way through the supply chain. So just some perspectives on prioritization, because it's a very real discussion that happens every day.
That's great. Thank you, Meda. Cisco, looking across the ecosystem and all the companies that you're working with and observing, would you say that by prioritizing quality, those companies that really focus on that have fewer issues, warning letters, 483s, or quality, better quality metrics? Have you been able to observe any sort of trend?
So that's interesting. And, one of the things that we've been trying to do, obviously, with our efforts here at Case for Quality is to get better quality trends, right? More objective data, move the focus away from the compliance metrics. It's one of those things that the companies who've done it, and we've seen the information and data, yeah, you see it clearly. It's out there, right? And it's just so many things, even in these discussions, that we could comment on, that I'm just blowing my mind here on my end. But yeah, you can see the distinction and the difference, right? That idea of, and it's not a question, I think I like how Sarah put it. It's not putting priorities so that you're competing on activities, right? It's about taking the idea that the first goal, and it's even why we exist as regulators, right? It's about that patient outcome and that patient safety piece. Put that first. Everything else feeds into that portion. Medhad gave a great set of example. The idea that cost is also something that should factor in, but not at the at the cost of in exchange for, right, that patient safety or the outcome on that side. These are all just the principles that we're looking to see and drive. And you see the companies who are engaged in that, and you see that in the journey. Nothing's ever perfect, but they are willing to take that step forward. They're willing to come and engage with us. We're trying to be part of the solution and be part of the process. I know that it's probably not the commonplace thing to say from a regulator standpoint, but it's something that we've always talked about throughout this entire journey on Case for Quality, right? Patient safety focus, that's first. You're a business. You should be able to make money, and that quality should drive that value. That's perfectly okay. The last thing you should be worried about is us as a regulator, because if you're doing those things right, that idea of compliance just comes out naturally. It's the outcome that happens. There's a lot of flexibility in those rules to enable that. In some cases, we do need insight. We do need to learn. We need the data. Bring it to us. I know it's scary, but we can't adjust. We can't adapt unless we see what's happening. So I think, with the companies who are doing it, you see it clearly. It stands out. Then, the goal is, how do we make this available so that other companies can follow that same methodology and model? Great.
Thank you so much. Let's go on to our next topic, which is prevention versus reaction. I've seen many companies, in their quality dashboards, and they're very much focused on rework and service calls and recalls, all metrics that describe quality after the problems have gone out into the marketplace. And not so many companies are really looking further up the value chain, looking at process quality, leveraging tools such as quality by design, or even supplier quality as much as they could be. So, Meda, I'm going to ask you to talk a little bit about Stryker and your perspective on prevention versus reaction, leading versus lagging indicators.
Absolutely. Thanks, Pat. Yeah, I think, a lot of companies start by focusing on recalls, and complaints. That is our lagging indicator, but a direct indicator to the impact on customers and patients. I think we've evolved through our journey to go further upstream into our product cycle and looked for further leading indicators. We, on our dashboard today, have process defect per million, right first time, scrap costs. Of course, we do look at rework, process rework as well. Are we able to manufacture the product right the first time? It's similar to yield or first pass yield. We also have supplier DPM, so supplier defects per million at our incoming. So we're trying to move the quality measurements further upstream. And as part of that journey, what we've realized is the more prevention we can do further upstream prior to the product shipping to the customer is better. And it is more efficient to solve a problem that's further upstream than to rework something that's in the final stages of assembly and then have to scrap the product. So continuous improvement culture came through that, and we've been on this journey for a while now. But there's a lot of encouragement to our assemblers, our line supervisors, to continuously look for and raise their hand, as we discussed in the previous session about, hey, this doesn't seem right, or there will be an issue here if I don't make it better, if I don't rearrange my workspace better. So the continuous improvement culture is important. The lean journey is important to help prevent those issues. I would say going further from even manufacturing into development, what we found is that if we focus our efforts of quality into the new product development cycle or the R&D phases, it has paid dividends for those products that have consciously made the decision to have a design quality assurance or new product introduction quality engineer. We have different names, or advanced quality engineer, whoever we want to call them as, but a engineer sitting right beside the design engineer, but with a quality mindset to say, let's use this connector instead of the other connector because this connector is better suited, or hey, let's use this Loctite versus the other Loctite because it's better performance. So right during that design phase, if we are able to design quality into that product, that's prevention at its core. That way we don't have to worry about anything that happens downstream. So this is a hard one. We've had some great successes. We've struggled a little bit as well, oftentimes, because it's hard to predict what could go wrong. But having robust DFMEAs, having robust PFMEAs is super, super important here. And the last point here I would say is on the supplier selection and process capability. A lot of times for the company, supplier is an afterthought many times, or it's only a cost play. I think focusing on the supplier selection in such that not only are they giving us the most cost-effective component, but also they have robust process capability and they're able to meet the ramp-up needs that we would want is important. So focusing on supplier process capability as well as our own internal manufacturing process capability and really putting focus on driving that, driving those processes to excellence to a Six Sigma level is what we would want to strive towards. And that's, again, another example of how prevention and pushing quality upstream is going to help significantly.
Thank you so much. Sarah at Baxter, has Baxter's quality dashboard been focusing on preventive and predictive indicators, or where are you on your journey?
Yeah, there's a part of me that wants to say what Meta said, because we're taking a very similar journey. And over the course at least of 5 years, maybe 6 now, we've really matured our sets of KPIs. So we did the same thing. We looked at our KPI base. We said, where can we look further upstream in our processes? Where can we tackle the design issues that we may have had? Where can we look at our supplier base? And like I mentioned earlier, the things that drive good quality are the same things that drive good performance. So when we created this collaboration and this intertwining of the KPIs that drive the business and drive the work and drive the function, we put the focus on having a state of control over all of our processes and in our facilities and in our new product development. it really drove this improved quality culture across the board. And we're seeing the results downstream. So instead of, again, like Mita said, instead of looking downstream, we're moving all of our indicators upstream. And it really hones in on that message of don't produce bad product and then inspect it out later. You want to just produce good product and have good product right the first time, right? So that's the concept that we're going after.
Great,
Got a lot of luck.
Thanks, Sarah. Joe, your experience at Hologic?
Well, I'll go back to the COVIDian. I used to work for someone who used to say, in this slide, I think we describe what he would say is an adaptive self-learning culture focused on continuous improvement, using lessons learned, and sharing and implementing best practices. And I think that sort of summed up the approach, whether you're talking internally or externally. And what Meta and Sarah have touched on too is having that supplier partnership. It's critical. Having suppliers that not only have process capability, but have also demonstrated the willingness to adapt your culture, right? So those are key partnerships, and those are key suppliers that you want to engage with, because it is really all about working towards being more preventive, designing products so that you're not inspecting quality, you're designing quality into the product. So doing it very early and upfront and often, and having that engagement with suppliers. And those are the things that we started to see as part of the Quality Begins With Me program, was what we could do internally, and then how did we spread it to our suppliers, and what were the expectations. If you wanted to be a supplier, you had to do these things. And we've talked about a lot of the things that within a company, what's the ROI, what's the return on investment, what's in it for me type thing. And we got a lot of pushback from some suppliers at first, but when they started to see that not only did it improve the performance and the quality of the components and products they were supplying to us, but it improved their entire infrastructure and ability to service other clients, the investment that they made was worth it. So I think what Meta and Sarah have talked about is exactly right. It's not only being preventive within the four walls of your organization, but how do you spread that preventive nature to your other, to your supplier base. And there's always going to be an element of the data. You can't do anything, and Sarah talked about this, you can't do anything without the data, right? And so that's going to drive a lot of your decisions, and it's also going to drive a lot of your prevention.
Great, thanks, Joe. Cisco, what all this sort of brings me to a question about the ecosystem. You're looking at specific companies, but I imagine FDA, CDRH is also looking at the supplier network, the distributor network. Am I right? Do you take an ecosystem approach, or do you focus specifically on the points within the ecosystem?
So let me answer that with regards to the current state and maybe what we want to be and where we want to be, right? Because this is all part of that journey. Being able to holistically see that whole ecosystem, that's the goal, right? That's really where we want to be operating. That's, I think, going to provide a lot more context, benefit, and really help focus even our activities and efforts on what is going to be the best outcome for the patient. What do we see now? And that's currently, just what is that one point in time and that engagement. And then we do rely a lot on the companies and the organizations to manage the portions of that further pieces of the ecosystem that are part of their responsibility. So in absence of getting to that end goal yet, again, just like every other company does, we start our journey. And how do we do that? By working here, building out these programs, finding ways to enable more companies to operate in this fashion and being part of that solution so that we could all collectively move in that direction. But it is, the reality of where we are and hopefully where we can be down the road.
Great, thank you so much. So our last area of focus in this webinar is really around measuring the value of quality. And a very brief bit of history on this. When Case for Quality originally kicked off, there were 4 work streams, one of which was around competency development. And then the competency work stream decided, well, let's focus on a couple of things. What is an effective management review? There was a separate paper on that. And then also measuring the value of quality. And when I was working on it with the team, one of the things that was eye-opening is that, companies don't, and you noticed in the survey at the beginning that not a lot of companies really measure the impact or the cost of quality. They see quality issues, but they don't necessarily track the costs. During the development of the white paper on measuring the value of quality, we came to find that the impact of poor quality extends far beyond the company, the manufacturer, that there is a huge impact on healthcare providers and an impact on the ecosystem overall, including the regulators. There are increased costs because of poor manufacturing quality. And so actually I'm going to start with you, Cisco, on this one and see if you can share, please, a little bit about your perceptions of cost of poor quality at any given sector within the companies that you have oversight for, or just in the ecosystem overall, or with the agency.
When we started the Case for Quality efforts, it was originally launched and kicked off as the business case for quality, because when a lot of that initial analysis was done and work was done, there was just data and feedback that said that there was a huge amount of waste that was being put into the system, oftentimes overly so. And I think we owned a piece of that. It's the overt focus on compliance and not really thinking through and figuring out what was the best way to achieve the end goal and the result moving forward. That, decades of operating in that fashion really has left a lot of people also thinking in terms of the compliance metrics and goals, and that has had the impact on industry. We see companies who are starting to shift, who are moving in that needle, they're driving that dynamic. And again, we've seen the thread throughout the whole conversation today, right? That better integration of that data, turning it not just about the cost of quality, but really what's the value of quality, and really changing the dynamic on that. I think it's, at least in a lot of the participants who've been open and transparent and sharing their journey with us, it's just highlighted better investments, easier justification on the return of ROI, better understanding of what's going on and which changes are really driving value right within the organization. And from our standpoint, it's also given us insight into the fact that maybe we can be looking at better data, better metrics, and collaborating to really help move the needle or keep that momentum that's already started. But we know that it's out there. It's really one of the reasons that this originally kicked off. We always try to make the case. It's better to be preventive. I think you heard me say it up front, much earlier in the process, lower cost there than at that recall standpoint. But that was the only window we had at the time. I think throughout this journey, we've learned that there is a lot of opportunity in between. And I know you've gone through that process and seen it yourself when developing a lot of these activities and some of the previous work that was done in Case for Quality. So I think it's there. We started in that journey. I think we found that there's a much broader, more holistic message around this, but foundationally, that should be a big driver for a lot of companies.
Great. Thank you so much, Cisco. Joe, I know that you and your career have done some work measuring the cost of quality and the value of quality. How have you basically used those metrics to drive improvement?
Thanks, Pat. The approach that we first took, and I think you guys have talked about it, is the cost of poor execution, because there are a lot of moving parts into measuring the cost or value of quality. So when we looked at what was the best approach to eliminating or reducing costs, we looked at those things that were costing us because of the poor execution. So the cost of a recall, the cost of rework, the cost of returning things from your warehouse back to your facility for those reboxing and re-inspections. And those things were above and beyond the expected costs which you sort of embed in your design, right? Or embed in your manufacturing operation. We all have scrap costs. We all have some target where, there's going to be an expected amount of scrap within your manufacturing process. So that started things off, right? Measure the things that were above and beyond what were expected to develop the I would say overall the comfort in measuring those costs, and then sourcing that information. I think Maida talked about it really well, is that they already have metrics where they're measuring those, they know where to measure their scrap rates and things like that. But when you're talking about a traditional approach to cost of quality or cost of poor quality, there have been so many different approaches. Like, everybody uses a little bit different approach. So we thought that the best thing to do is, let's talk about measuring the costs of poor execution first, and then work our way towards those costs that, how can we reduce let's say, 3 or 5% scrap rate embedded in the manufacturing operation? How do you go after that? Because that's where the real costs are. But we needed to start somewhere, and that's where we started.
Great, thanks, Joe. Maida, I'm going to ask you a tricky question, and that is, it's relatively easy, even though not everyone does it, to measure the cost of poor quality. But have you at Stryker taken any steps towards measuring the value of good quality in terms of market growth, customer retention, or anything like that?
Yeah, I would say that it's a tough one. It's a tough question. I think we would measure good quality in terms of growth. With Stryker, we say quality is our master brand, and customers associate, when they buy Stryker product, they are expecting high quality product. That's what we stand for, and we aspire to stand for. So I think as we see growth and ramp up, and our sales rep saying, yes, I want to sell more of this product, I think that's an indication that things are going well and customer satisfaction is there. So we have a customer experience metric. We hear this, and we make it a point to hear about these. Even though we are a quality function, we sit at reviews where we listen to our field reps, not just their complaints, but also when things are going well, that, hey, business is really going well. Thank you for the consistent supply, no back orders. Thank you for high quality. And the trust that gets built up with our customer base, whether it's surgeons, nurses, or our patients, and the credibility that comes with that high quality is certainly something that we want to measure, take in, and pass it down through our organization.
Great.
So
thanks.
yeah, I don't know if there is a metric necessarily that signifies, but it's all tied to, again, growth and patient satisfaction.
Great, thank you. Sarah, where is Baxter on its measurement journey in terms of the value or cost of quality?
Well, much like Joe, we started with cost of poor execution, and we then were able to add in some of the value drivers. And we've just recently started looking at how we can include reputation in the marketplace, growth in the marketplace, market share. I mean, we are a for-profit business, and so we have to take all of those things into consideration because we do want to have stellar products, and we want to have the safest products on the market. And it can be a little daunting when you're the first out there asking questions and having these open conversations with your customers. All of the customers aren't necessarily comfortable having these types of conversations either, right? So you just have to start. So we're early on in our journey, but I'm confident we'll get there soon.
Great. Well, I want to thank all of you so much. If we can go to our next slide, we'll close this session. We'll open it up for Q&A, of course. But before we do open it up for Q&A, I just wanted to say that the next step in our journey as a team with the playbook is to get companies to actually pilot the practices. There are 10 practices. You've seen some insights or gained some insights into 4 of them. And we do have a formal pilot process that we'd love to work with you. I know that members of the team who worked on the playbook have expressed a willingness to be part of the solution and help companies implement these pilots and measure the value that quality focus and culture of quality brings to their companies. So with that, I think it's time to open it up for questions. Great. So those of you who are attending, please feel free to ask some questions. You can ask questions in chat, or there is a submit a question button that you can push as well. And and if you have a question for a specific panelist, you can ask it, direct it that way as well. While we're waiting for questions, Joe, I wondered if we could talk a little bit more about the pilot, and not only how we might help companies pilot, but also any thoughts in terms of what's next for this work stream. We have a playbook. Now it's time to get some traction. What are some of your thoughts in terms of making this real?
Okay. Well, thanks, Pat, and thanks everybody for being participants on today's call. So when we look at the pilot, and you ended the presentation with the pilot slide and some of the areas that we're looking at, we've got 10 areas, but I think as we talk about it as a team, there's certainly some information within the survey results when we talk about prevention versus reaction, and where we ended the conversation around cost of quality or value of quality. So certainly a pilot in those 2 areas makes sense, and we'll be talking more about those and how do we build that out. But again, we don't want to discourage companies who want to take a look at other areas. You mentioned there are 8, or there are essentially 8 other areas within the playbook. So if a company has an existing program that they want to build out further, or leverage current programs that they have that they want to build out further, we can certainly help them with that in a pilot approach, as well as companies that are just getting started in this journey and help them identify in areas that might be more impactful, one area over the other, in terms of putting in series of behaviors. Patient engagement, as Maida talked about in the presentation, the value it has of engaging with your patients. So that's certainly areas that the team is looking at from a pilot. The other thing is that we'll be announcing very soon a series of webinars, which will be identified or designed to be more deep dive into areas within the playbook. So we have our first webinar coming up, which will be a conversation with leaders within quality for some of these member organizations around how are they implementing the culture, how are they seeing that culture, what their vision is going forward. But then those other areas will be, I think we've got on target about a total of 6 webinars in the series. So over the next few months, we'll be focusing on those. And that, I think, will help drive companies or lead companies down a path of, hey, tell me more. Let's pilot this area and start sort of expanding the playbook more.
Great. Thank you, Joe. And I do want to reiterate that many of the people who participated, probably about 10 or 15 folks who have been part of this working group, have expressed a willingness to help companies that want to implement these practices do so. So please reach out to us. Maida, I wonder if you could talk a little bit about how companies can capture a baseline. One of the big topics is, of course, around culture of quality. How do you measure something like culture?
Yeah, it's such a it's almost a feeling, and it's part of the group and a team sentiment is how I define culture. We have, including some of the items we discussed in the presentation, how we measure or how we check on our culture is we have annual surveys, we have pulse checks. We strongly advocate for Gemba, walking the lines, part of our lean strategy and part of our continuous improvement. There is a wonderful recognition program that we develop around somebody who's caught an issue, instead of penalizing them. It's more of a recognition. Hey, thank you for catching it before it went out to the customer, like a catch of the day. So there's multiple levels of reinforcements to keep that culture alive, because that's so important. It's not a one and done thing that somebody sets the strategy and it's there forever. It's a constant, everyday journey. It's an everyday feeling, and so important as leaders of the business that we reinforce that and keep communicating that throughout our organization.
Great. Thank you. Sarah, I know you said you might have some audio issues, but would love to hear your perspective.
Sure. So hopefully you can hear me okay. I think what we did is we took advantage of the tools that were available to us in the Voluntary Improvement Program. So we had the CMMI appraisal performed across several of our sites. And we took the output of those appraisals to look and see where we might have some systemic issues that pointed directly to our culture and pointed directly to our behaviors. And that was the approach that we took, and it worked for us, but we had that ability to look across several sites with the CMMI appraisal.
Great. Just out of curiosity, did you find a good level of consistency across all the sites, or have you found that it's important to balance and spread culture evenly?
In a few key areas, we're very consistent. I'm happy to say that patient safety is number one on the top of everyone's mind as we go site to site. Where we differ a little bit is truly in the understanding of where folks impact that patient safety and their understanding. And I can talk about that a little bit later. But
Great, thank you. Cisco, I would love your perspective. You have a unique opportunity to look across the entire ecosystem and look at many, many different companies. How do you sense culture in any one or in a group of companies?
That's interesting because it oftentimes isn't in a lot of the data or the metrics that we typically see or get. Right? It is not something that's visible there. It's one of the reasons why even when we carved out and created the activities within VIP, what we focused on was that engagement, right? Maintaining that proactive communication with us as an agency. I think that speaks a lot more volumes towards the culture at the organization, right, than the data that we see. And I think you heard it already from Meta, that measuring it, it's difficult. It's very specific to the organization, to how they do things. It's that proactive continued march with that reinforcement going on, and it's very organization dependent. What I can tell you is that it starts to show in just the way the communication and the interactions happen from an agency standpoint. So we see that aspect of it. With the data that we're starting to get from the model now, we do start to see, there are certain practices that will start to spike up in terms of you start to get that enthusiasm, that momentum going in the organization. It's not, again, a 100% guarantee. It's not a perfect thing. It's just a trend that starts to show up. But that's always the difficult, tough thing to deal with. We hear it when investigators go out. We hear it when even the appraisers go out. When you walk into an organization and gets it, you feel it. It's right there. It's there in the way they interact and they do things. So I think that right now, that's the best gauge we have is, keep that interaction going. The more we help encourage that, I think the more it feeds back into the organization and support some of the practices that they're already trying to improve or put in place.
Great, thanks. It's interesting, your response. We work with a lot of companies, and there are companies that fear the FDA and that are worried that you don't want to be transparent because it's just going to bring all sorts of issues. And then there are other companies that understand and have found that working collaboratively, and it's not that the FDA is there to
necessarily help you solve problems per se, but work collaboratively in terms of regulatory science and moving down the pathway towards approval, if that's the objective. That the culture at the FDA has profoundly shifted, is the sense that I'm getting. And rather than ask you that first, I'm going to ask Sarah and Meta and Joe if they've perceived that, and then ask you to comment on that, because I think that as much as the industry is changing, so too has the regulator. Maybe Sarah, start with you on that.
Yeah, happy to add, Pat. So I think for us, it's night and day, frankly, from just even a couple of years ago. The ability to pick up a phone or send an email and say, can we have a quick conversation around something that we're struggling with or something that we're seeing, and engage directly with partners at the FDA that were seemingly out of touch or off limits to us even some time ago, are now readily available. And I mean, we had conversations within a week time span. It used to be, oh, can we schedule a meeting within 3 months? We don't know. And it's almost an instant interaction. It feels like it anyway. And that's really promising. And it's lifted the spirits, and I think also helped change the culture in our organization too.
Meta?
Yeah, I would certainly agree and concur with Sarah's notes here. Over the years, I think, and kudos to MDIC and Case for Quality and FDA's partnership there. It's been such a huge step to say, hey, industry, we are here with you to support you to drive Case for Quality. So that has been a great barrier removal from previous times. If you look at 10 years ago, yes, very much it was that everybody feared the agency. And as we've progressed through, initiatives like the Case for Quality is hugely beneficial. And our experience with the MDIAP program as well has been phenomenal. And as we've embarked that, to have seen the agency partner with us so beautifully has been great. It's a voluntary improvement program. And I have to say, as we went through the first year and as we trickled that message to our teams, I think the initial reaction was like, wait, what do you mean it's not an audit? Like, what do you mean they're not going to see our data? Like, is it just a conversation? And yes, indeed, it was just a conversation. And yet, truly, the culture, the true quality, our processes came to light. And the voluntary aspect of, oh yeah, we know about this, we're going to solve it, is been wonderful. So great change, and I can't wait for the future of this as we improve in our medtech and FDA relationships.
Joe, can you comment both as a MDIC leader as well as a former industry leader?
Sure. And so I was sitting here listening, and I was trying to, I don't know how much more I could add to what Sarah and Meta have said. But it's, when it comes to culture, and Cisco touched on it, it's, you feel it when you walk in the door. You could put posters on the wall, you could put slogans on, etched in the windows of your facility when you walk in the door, but it's not until you walk in and meet the people and talk to the people where that culture really is, you can really feel it. And that's the beauty of the programs that Meta and Sarah have talked about, is it's enterprise-wide, it's across all of your divisions. It may be implemented slightly differently in one culture to another, in terms of a country or another, but it resonates, it's consistent. And so when the agency walks in, it's the site's ability, it's a site's opportunity to celebrate that culture and so really be out front and open with that, right? And I think that says a lot to the folks that come in as regulators who can see, touch, and feel the culture of your site. With regard to, I'll put my MDIC hat on now. One of the things that I've always appreciated most about the Case for Quality, MDIC, and FDA, and the programs is that as a person in quality and regulatory for a really long time, industry-wide, we would always have conversations internally saying, why isn't the agency doing anything about this? Or do you think they'd be willing to talk to us about this idea we had? The reverse is happening, right? And so the agency is out there promoting and saying, hey, we're endorsing this activity. We want firms to come to us with these ideas. We want to engage in these conversations. So the whole approach has shifted, right? And MDIC has helped facilitate that by creating these opportunities and forums like this for us all to get together to hear from FDA. But we're not having conversations, at least not in my experience, where we're sitting around a table, FDA is not at the table, and from an industry perspective, we're scratching our head saying, well, why isn't the FDA thinking the same way we are? Because right now, since the case for quality, we've all been on the same page when it comes to thinking what's the right approach, what's the best way to advance regulatory science, protect patients, and provide safe and effective products. We're all on the same page. So that's really where the shift has occurred, as far as I can tell.
Great, thanks, Joe. And then Cisco put you on the spot for self-assessment, and you've been the program director and closely tied to case for quality. How have you perceived the shift? Is it a transparency, a collaboration? Is it, what's happened over the last 5 years from your perspective?
So I think there's a lot of stuff and dynamic at play, right? Visions that the leadership has had on us engaging more and, really trying to reach out to the broader stakeholders. And I do mean a broad stakeholder. They're not talking about just the industry, but the idea and the work that's been done now on bringing in patients to help even inform what we take on, what we do, how we focus on things, what we should try to drive, has opened up, I think, a world of insight in terms of what is it that the people who we're trying to serve really want. And then that brings us back to the question, what's the best way to achieve that, right? If we are looking at that kind of adversarial engagement that I think people were accustomed to a while back, everything's very reactive. And, you're always working towards what is that data that might be coming in, 6 to 8 months down the road after issues have occurred. Finding out and saying, if we talk and engage ahead of time, if we work collaboratively in these fashions, if we encourage that proactive communication and bringing some of those issues ahead of time, because there may be a situation where we collectively as an agency need to do something broader to change a dynamic, change a policy that's really slowing things down, right? We don't know that or see that without the engagement or the communication. But what we're seeing also internally is as some of our staff participate more and do more of the collaboration engagement, it's one of these weird situations where it's always been a possibility, but no one ever really pursued it. Everybody thought it was also forbidden on our side. And the minute they do it, it's like, well, we could do this. This worked really well. And it was a lot easier than just what we were going to do ahead of time. And, the information we get is, it's richer, it's clearer. We understand the dynamic of what's being managed on the outside from an industry standpoint, and we can better position ourselves to participate. But the other big thing about that, and you'll see that I think more as the agency continues to progress and the upcoming years come up, because it's shown its impact and benefit. Trying to get that engagement earlier and faster so that all of these things and that improvement happens proactively in development and that design, so we can get to the real preventive stuff instead of being reactive. That's the strategy and the path forward that we're looking to move at. It's slow. It's a lot of just changing what has been decades of dynamic and culture, but it's one I think people do recognize and enjoy once they actually actively start engaging and participating. It's coming. It's just change.
Yeah, but I think the industry has perceived that change and welcomed it as well. One other question, we've been talking about how great leadership engagement is and how important a culture of quality is. We haven't talked a lot about the struggles of getting there. And maybe ask each of you to comment, starting with you, Sarah, on, can you tell us some stories about some of the challenges and how you overcame them?
Oh, I can tell a lot of stories. I think most importantly, our biggest hurdle that we had, and this is with the perspective that leadership is at all engaged at all levels in the organization, right? So I can say we're very lucky. Our CEO and C-suite completely engage, understand. They just want it more and quicker, right? But when you go to engage leadership at every level in the organization, I think the biggest hurdle that we had to tackle was gaining the trust and understanding that all of this culture stuff is actually going to lead to real benefits. So we did two things. One, we made sure that the patient and employee connection was stronger. We needed to make sure that we improved critical thinking skills, and so that people could have the courage to do what's right and change their behavior. And then we took a case study of one of our early VIP sites and showed them the difference that it could make. And we have improvements across all of our sites, but the case study that we happen to use, I mean, we showed dramatic improvement. Turnover was way down, open headcount was way down, daily production, I think our daily production went up over 50%. Defects and complaint rates went down dramatically. So when everyone in the organization started to actually see the tangible benefits, that's when we started getting more phone calls from more facilities saying, hey, how do I do some of this stuff? How do I engage in some of these principles and practices? How do you include me in this program? So it was kind of the proof in the pudding type of an approach, but it was really important.
Thank you so much, Sarah. Maida, how about yourself?
Yeah, plenty of stories in terms of hurdles, and again, it's a journey, so it's always evolving and improving journey. But as I mentioned, even for us, the engagement and the tone from the top, all leaders convey that message. This is important. Quality is important. Even as it goes through the organization in the past, we've had hurdles around understanding the why. A lot of times I see speakers as a quality, in fact, would be seen, the function would be seen as a police saying, oh my gosh, let's not have quality, or let's, go to this, otherwise CAPA, it'll stop what I want to do, and it won't go fast. And I think some of those misconceptions around quality is not care for policing, and hey, the issue is not a quality issue, it's a product issue, a process issue. Quality is just a function helping the overall organization towards it. So I think, again, it's a mindset shift. If you have, quality department will take care. It's not that, it's all of us are in it. No one function, one person is really responsible. We all are. I think when you make that, what we've seen is as we made that shift from all of us own quality, and it's part of all of our metrics. We've recently had escapes as one of our metrics, escapes to the customers, and manufacturing has the same number as quality. All of our functions have that same mindset and goal. It drives so much more alignment and much more engaged teams. And I would say the continuous improvement culture that has progressed in the organization has helped with this as well. So when you see an assembler making improvement on his workstation, reward them and say, this is great and it's good for quality, and even though they're not in the quality department, I think that's really helpful. So very deliberate, even in terms of recognition, where we want to make sure all functions are included. It doesn't matter if you're R&D, IT, finance, manufacturing, quality. If you are have had an impact on improving product quality, you are the quality hero. So yeah, again, I would say it's a journey. And great to see the progress so far.
Great, thank you, Medha. Joe,
we're getting close to the end, but just wondered if you had any stories on overcoming challenges to achieve better quality.
So I think Sarah touched on similar experiences that we had seen when we first launched the program. It was certainly having benefit of the CEO and the C-suite, strong endorsement from that group. It was communicating down through all levels of the organization. And in the early days, what we saw was this challenge that the middle managers had, especially on the production side, when we were encouraging folks at the front line to be courageous and to stop production when they saw something, to say something. And then the production manager being challenged with, well, gee, I've got delivery schedule to meet. I've got deadlines to meet. How can I afford to shut the line down? But knowing that the level above them and the level above them on top of that were encouraging us to do the right things, it helped ease that burden and ease some of that tension. And then as the results started to demonstrate, it made sense to do the right thing along the way. And then you eliminate those things from occurring. So you eliminate the chances for escapes, you eliminate the chances for line shutdowns and things like that. So it was really the proof in the pudding, to what Sarah mentioned. We could talk for days and days and days about the value, but you really needed to experience it firsthand. And unfortunately, you had to experience it, right? You didn't want those things to occur, but the reality is they do occur. So it's how do we react and how do we respond when those things do occur? And then how do we recover, learn, and then prevent? So I think those were the early stages of overcoming some of the challenges. And I think the next level of challenges is when you start to spread it enterprise-wide. It's about education. It's about educating folks that aren't closest to the product, the role they play in the quality of the product or the quality of the reputation of that company. And so it's an education. It's not as hard to convince them, but it's really to bring them on board and educate them on their role in a quality culture.
Great. Thanks, Joe. Cisco, we'll close the Q&A with you. Biggest challenge that you've encountered in the journey?
I could write a book on this, but let me see here. I think I'm going to echo a lot of what you've already heard because it's the same stuff that affects us. But one of the big items that we've got to always be on the watch out for as a regulator is this engagement takes trust. The minute some of that gets violated in some way, shape, or form on either side, it cascades rapidly. It's like wildfire. And then we've got to undo what went on there, understand what's going on. So it's that, trying to keep ahead of that and make sure that, the understanding is that none of this is driven oftentimes by intent. Stuff happens, right? So how do we just, on both sides, we don't always get our stuff perfectly aligned and correct. The other challenge we've got as a regulator is just speed on both ends, right? In some things are moving really, really fast, and our bureaucracy is having struggles in terms of catching up. And then on other sides, things are moving a lot slower than we need them to be to keep that trust engagement going. Those are our biggest internal challenges and hurdles. And then communication is always a problem. Always, it's people need to hear things the way they're accustomed to hearing things, and you can't hit everyone at the same time. And as Joe and Sarah said, it doesn't matter how much you communicate, it's until they experience it that they see the difference.
Great. Well, I want to thank all of you for a wonderful session, and we have a couple seconds left. If anyone has a final word that they want to say, this is an opportunity. If not, again, thank you, and look forward to the next chapter in leadership engagement and case for quality.
Thank you, everyone.
Great. Thank you, everyone.
Thank you.
Thank you, Pat, and the panel for a very interesting discussion and for your participation during the live Q&A. That brings us to the end of our two-day forum. On behalf of the Case for Quality Collaborative Community Steering Committee and MDIC, I want to thank all of our panelists and presenters for making this forum such a success. I also want to thank all of the members of the teams that work very hard on a voluntary basis to make the Case for Quality Collaborative Community a success. I appreciate all of your engagement throughout the year, and certainly appreciate all of your engagement during these 2 days of our forum. Remember to visit the MDIC website for more information about MDIC, the Case for Quality Collaborative Community, and the working groups and programs. Thank you all, and have a great day.